Hello everyone, my name is John Baxter, and I would like to thank you for this opportunity to describe the work that we've been doing on creating a new multi-resolution convolutional neural network for localizing cortical points that are used as targets in transcranial magnetic stimulation, or TMS. So TMS is an increasingly common treatment for a variety of different neurological disorders such as depression or chronic pain or OCD, and what all of these have in common is they all arise from really abnormal cortical neural behavior. So in TMS, we try to disrupt this pathological behavior by applying varying magnetic fields to the specific cortical locations from which this behavior arises. There's a lot of discussion in the literature over whether or not TMS actually works because there's a really large degree of patient variability. And one of the reasons underlying this is there's a really large degree of variability in terms of the accuracy these cortical regions are being targeted. Although this procedure was originally performed blindly, only using locations on the patient's skull as a reference, more recently people have started using MRI as a way of doing image guidance. Now, the current clinical standard of care is for an expert to identify the regions on the image that they would like to stimulate. However, there are automatic methods to do exactly this, most of them using a pre-annotated atlas. However, this atlas registration process doesn't really capture the patient variability and thus can lead to inaccurate results. So our goal is to replace this atlas with a convolutional neural network that can localize these cortical target points not only more quickly, but also more accurately. Now, there's a number of technical challenges. If we use a traditional convolutional neural network and interpret this as a regression problem, then we know that each neuron in the network has to keep information not only about the presence of a potential target point, but also the location of that target point within the voxel that that neuron represents. Now, as we apply pooling operators, these voxels get larger and larger and larger, and therefore saving the intravoxel location gets more and more problematic. We can avoid this by treating it as a segmentation problem, using architectures such as UNet to manage this intravoxel location. However, we have a large number of points, not too many images, and thus there's a really big problem with class imbalance. So our approach is to create a point regression network that is inspired by UNets. So like UNets, we have a series of resolution layers that process the image at that particular resolution. In our case, each resolution layer works by taking a small image as input and then outputting where it believes the points to be located in that small image. So we start off by taking our entire image and average pooling it until we get a very, very coarse resolution image that we can feed in its entirety to a resolution layer. Now, this gives us a very coarse estimate of where our cortical points are located. However, we can use that estimate at a slightly finer resolution. We can crop the image centered at that estimate and send the cropped image to another resolution layer, which can then update its estimate of where these points are located. And we can do this repeatedly, updating our estimate and cropping increasingly fine resolution images until we reach the native resolution of the T1 weighted input. Now, there's still a technical issue here, and that is the cropping operator is not differentiable with respect to the location used as the center for cropping. This means that we've had to design, in addition, a multi-resolution loss function that ensures that gradients are sent to the appropriate resolution layer. So what this does is it looks at the magnitude of the error of the estimate and weights how much gradient to send to each of the resolution layers accordingly. The idea is that as the error approaches the resolution for a particular layer, that layer is the most receptive and most effective for changing the prediction. If the error is too large for a particular resolution layer, then that layer can't possibly learn from it, especially if it lies outside of the cropped image. So our loss is a series of weighted L2 errors, and these are weighted in a way that it also self-balances, that the magnitude of the error going to the resolution layer is always on the same order. In order to evaluate this, we collected a series of 26 T1 weighted images of patients undergoing TMS therapy. Now, these images came from different hospital centers and thus a variety of different MR scanners, and even had different orientations. So we had to do a little bit of image pre-processing at the very beginning to reorder the axes to be in the same RAS coordinate space, as well as normalizing the intensities using approximate min-max normalization to all be within the same size. We then zero padded the images to give them a consistent size of 256 cubed voxels. In order to augment the size of our training set, we also performed random left-right flipping. Now for these images, we also got ground truth annotations. For the non-motor target points, that is for depression or OCD, we had one annotator determine these points, and for the motor treatment points, which are used for managing chronic pain, we actually had 3 annotators, allowing us to get an idea of the expert variability. So in terms of qualitative results, we can see that there's a lot of variability for our experts, shown in red. Now, our proposed CNN actually has smaller variability, and it seems to be clustered close to the barycenter of our expert points. The atlas, shown in green, is also close to this barycenter, but a little bit further away on average than the proposed CNN. So if we look at these non-motor treatment points using our single expert annotator as the ground truth, we can see that our proposed CNN performs similarly or outperforms Atlas registration. So the numbers are fairly close, often being within a couple of millimeters, excepting the left orbital frontal cortex, which is used for treating depression, in which our proposed CNN had statistically significantly better performance. Now we should take all of these with a little bit of a grain of salt because they're masking potential human expert variability, and we don't know if our one expert annotator is really the ground truth. This is especially apparent when we look at our chronic pain treatment points, where we have 3 expert annotators and thus an estimate of the expert variability. Now what's interesting is that our proposed CNN has lower error than Atlas registration for almost all of the points, and this is statistically significant, excepting the right lower limb motor cortex area, in which the two are almost exactly the same. Now, our human expert also has statistically significantly better performance than the Atlas for all but, again, this right lower limb motor cortex. But what's particularly interesting for us is that the proposed CNN and the human expert actually don't have a statistically significant difference in performance. Not for any of the points. Sometimes our CNN performs a little bit better, sometimes the experts do. It's really, really close. This gives us some evidence to believe that our proposed CNN is actually performing with human expert level performance. So our CNN also has some secondary benefits. It's significantly faster than registration or human experts, but it's also more accurate than registration and borders on the performance of said human experts. Now, we can hypothesize that this is because it's more robust to patient variability than the registration algorithm is, but it's at the moment a little difficult to tell that for sure because our experts themselves, and these are the basis for our ground truth annotations, also have a degree of variability. So our future work is to make this much more objective and to collect stimulation-specific data that really tells us the underlying functional region being stimulated for a particular location, which we can use as a really objective form of ground truth independent of our experts. So in this talk, we've presented a novel multi-resolution convolutional neural network similar to UNet, but instead of for segmentation, it is for localizing points specifically in volumetric images. We've applied this network to localizing the cortical target points for transcranial magnetic stimulation. And even though we only had 26 images, we already have achieved equivalent to expert level performance. So if you have any questions, please don't hesitate to email me. And thank you for your time and your attention.